Hello. Hi, everyone. Hi, this is Dr. Dr. Chefu, your girl, Hairloss physician, hair transplant physician, hairloss coach. So we're back again today. So we're going to be with Dr. Toomer. It's going to be an interesting topic today. I'm always excited. Initially, I'm always nervous. Then when they come on, I'm excited because they have what? A wealth of knowledge to give, okay? To share with us. So we're going to be waiting for her. Let me see. I have to add her. So we're going to wait for her to join us today. Other than that, hope everyone is doing good. She just waved. Awesome. Okay, let's see. I added her. Invite. I just invited her. So hopefully she will be able to join us. She's here. She's here. She's trying to join us. Let's see. So if you're on your laptop or computer, try using your phone. Okay,
Yeah,
yay, 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 yay.
realize that you can't use your computer to
I
join.
know. Are you on the computer or on your phone? What are you using right now?
Well, I was hoping to use my computer.
No, it doesn't work
Yeah, it
on
doesn't
computers.
work, but yeah, I just learned the hard way. I don't do very many Instagram lives. I need to start doing more. So,
Yeah, most people I have to tell them. I always forget to say use your phone just in case, But can you hear me? Okay.
make sure I can see you as
Okay.
well. Yes.
Can you hear
Um,
me? Can you see
well,
me?
you know what? I realized what had happened. I had my headphones through
Okay.
this. That's why I couldn't hear you initially. Um, and there absolutely is no way to do it through. You can't do it through computer at all.
Just can. I think it's best with the phone because it's
Oh,
easier. You
okay.
join. Yes.
Okay.
Yeah. Most of the physicians that come on, they usually have that issue with
With
trying
the
to using their computers or
computer.
laptops. And
Okay, well,
yes,
I'm just going to adjust this a little bit because it's
mhm.
too close. I'm going to try to move my, oops,
That's okay. We're here.
move my,
We
move my
have one
stand
hour,
back.
so we're not going anywhere. We have
There
one
we
hour.
go. Okay. So there, that looks a little bit better.
Are
So,
you good?
um, yeah, I think we're good.
You look beautiful today. First of
Oh,
all,
thank you. Thank
see,
you. So you too.
pictures don't do you justice.
Oh, thank you.
You're
No,
welcome. You're welcome. I'm excited having you today. And am
thank
I
you. I'm
pronouncing
glad
your
to
name
be
right,
here.
Dr. Tumor? Is
Tumor,
that
yes.
the right
Yes,
tumor?
yes, yes,
Good, good,
yes.
good. But now, before I even tell my audience who you are, I just
Mhm.
saw you feature on the news. Was it ABC?
Yeah, yeah, I saw. I did a news segment in Chicago, ABC News 7
Okay.
in Chicago.
So I don't want you to
So,
downplay that. I want you to tell our audience a little bit why you were on ABC.
oh yeah, so I was asked to talk about medications,
Hmm.
particularly GLP-1 medications, and kind of dispel some of the myths, some of the pros and cons of it, and so I they invited me, so I went.
Awesome, awesome.
Yeah.
I saw you, I was like, yay, she's coming. And I
Mhm.
had to put it on my Instagram, I love people shining, and I had to say this so that people know the kind of positions we bring on our platform that, we're
Mhm.
not joking right here. We want the best of the best.
Well, I'm going to share this now with my audience.
Okay?
Um, and I do.
Okay.
I guess it's automatically shares with
It
my
does.
Instagram
Yes.
audience. So,
Yes, it does.
okay.
Yes. Are you
All right.
ready?
Yeah, I'm ready. I just don't know if all the wording's in my face or not, so I'm still gonna push this back so I can. Can you see my face, or is it
I
there's a
mean, you
lot of
look
writing?
beautiful. I don't know what
Okay.
else you want me
Well,
to
see,
look. Is
on
there something?
mine, I have it's like a lot of writing is on my face,
Okay,
so it's
okay,
like, and so I'm just trying to
okay. Just make
I'm
yourself
just gonna do this.
comfortable. I want it to be comfortable. So
Yeah, I'm
you have all the
comfortable.
time.
I just want to make sure that people can actually see me. I'm not, like I said, I'm not as familiar with
Using the phone,
Instagram lives as I am with Facebook. I do
Facebook.
a lot of
Okay,
Facebook lives.
Facebook
So
Live. Okay, so
yeah.
welcome to Instagram Live.
All right. Thank you. Uh,
Are you ready
yeah,
now?
yes, I am very much
Awesome,
ready.
awesome. So you're gonna do us the pleasure of telling us who you are, Dr. Toomer.
All right.
Okay,
Well, I am Dr. Catherine Toomer. I am
okay,
a family medicine and community health physician. I'm also a metabolic weight care management or weight management specialist, and also the founder of Your Light Wellness and Weight Care, which is a group of doctors that provide telemedicine weight care around the country, and the founder of Health, Wellness, and Weight Loss Centers, which is really the umbrella organization for many of the things that I do.
that you do.
So, courses, teaching, I have membership programs, and all sorts of things. So,
Okay, you said a lot, but we're gonna, let people,
yeah,
come in more so that at the end of the day, you're still gonna tell us what you do and how you can help us. Okay.
yes,
So
yes.
now, how do you help your clients? You mentioned a lot of stuff, but how do you help your
Mhm.
clients?
Mostly what I do to help my client is to find out what it is that makes them feel as if they're not themselves.
Mm,
I often, the number one symptom, if you want to call it that, is something's not right.
mm,
And so I take that seriously. And so we look to find out what's going on, and then we just go after the cause, because
mm,
it's easy to mask the symptoms,
mm.
but unless we go after the cause, it's not permanent. The change has to be now and when you're 90. That's
Okay.
my motto.
You said something is not right, like in
Yes.
terms of is it their health,
Anything.
weight, or just anything?
Anything.
Okay.
Usually, one of the reasons why I do weight management is because many of the times when we're not feeling like ourselves or something's
Hmm.
going on, the only thing we notice is our weight.
Oh,
Weight is a
okay.
symptom.
That's
So
wow.
when someone's weight changes, I
Mm,
know that there's something else going on, and I can look for that something
awesome.
else.
I like the way you said it. Like, weight changes most times. People don't realize something is going on, or actually they realize something is going on through weight
Mhm.
fluctuations, right? Yeah, I
Yes.
love the way you just said that. Okay. So how can people find you before we go into, the whole, how can people find you?
The best way for people to find me is on my website, which is
Okay.
drtumor.com.
Okay.
I'm also on YouTube as Dr. Tumor, on Facebook as Dr. Tumor. Um, and those are the best places to find me, because that's where I do regular posts, I do regular education. Um, and I often, and I do respond to comments
Okay.
on my posts. So if people have questions, I
Mhm.
also have Facebook groups, but they can all find those through my Facebook group as well,
Okay.
my Facebook page as well.
So you're not hidden. You're on Facebook. You're on Instagram. So nobody can say they can find you now.
No, 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 no.
So none of my audience can
Yeah.
say, "Hey,
And
doc,
on
where is
I'm
Dr.
on
Tumor?"
TikTok. And
Oh, you also on okay, we can find you.
yeah, so
Anyway,
I'm
okay.
pretty much
Th-
everywhere.
That's
And
awesome.
yeah.
That's good. That's good. That's good. Okay, now, so let's get into it.
Hmm.
Tell us about your journey in relation. So, okay, let's start with your journey with health
Okay.
before we get to the weight
Hmm.
issues and all that. Mm-hmm.
Okay. Well, my health journey really started with school. Really, I was used to be very active. I was quite athletic growing up, and then as I got farther along in my education, it became harder and harder for me to maintain that. And as my stress levels became higher and higher, it met my genetics, and it set me on this metabolic downward spiral,
Mm-hmm.
which, my blood sugars became uncontrolled, my weight then went up, which made my blood sugars more uncontrolled, and I just kept getting gaining and gaining more fat. And
Okay.
so by the time that my health completely failed, because I tried really hard to do all the things that I could given the time.
Mhm. We can't hear you. the tumor? Yes.
So that's what happened. I'll know
Okay.
to tap the thing. So so what happened over time is that I gained a significant amount of weight when, stress hit my
Mm-hmm.
genetics and my metabolic processes started to spiral out of control. And then about a month after my last daughter was born, I
Mm-hmm.
went into congestive heart failure.
Mm-hmm.
And that was my biggest wake up call. And at the time I was told, well, I knew the statistics just from being family medicine, but I had a 50% chance of living 5 years,
Mm-hmm.
and I had a newborn and a toddler, and so my health became my main focus because one, I had no choice if I wanted to live,
Okay.
but also because my family depended on it, and it became the focus for all of us because, as we know, many families kind of revolve around the mom
That's
and
right.
things getting done. And so my health became very much a focus, and it has been ever since. Later, I took that experience and the plan that I created for myself to turn my health around, and then turned it into my mission
Oh
to
wow.
help other people do the same, or at least help them prevent going through what I went through. So it's a lot of prevention, but also reversal as
Okay.
best we can.
Would you say being a physician played a major factor in your weight and your health
Absolutely.
issues?
Absolutely. The stress of
The
it.
stress of it.
Yeah.
So while you're helping other people, you are also battling with your own issues too.
Yes. Absolutely.
Wow.
It was.
Wow. Wow. So until you were diagnosed with congestive heart failure,
Yeah.
that was when
I was
there was a
also a
wake up.
diabetic as
Oh,
well. So
you
as
have
my
congestive.
weight went up
Mm,
and my metabolic issues got worse, I eventually ended up on insulin as
wow.
a diabetic. Um, and and so the three major, health issues I had were insulin dependent diabetes, then my um, obesity, and then congestive heart failure.
Congestive. Oh wow. 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 Okay now. So let's say now you're a physician, diagnosed with congestive heart failure, diabetes. How did it change you as a physician? Number one. And how
Hmm.
did it change how you related with your patients or your clients?
Hmm. Well, it changed me as a physician because I had to stop practicing.
Mm,
I couldn't practice medicine for
mm.
almost nine
Oh,
years.
wow.
Yeah. So I left medicine initially because of my health. I stayed away for a little while longer because I homeschooled my daughters for a little bit. And then when they went back into school, I went back into practice. And I never went back full time, mainly because stress management became such a primary
Oh, wow.
concern of mine and such a primary focus. I never allowed myself to go back into a situation. At least I tried to avoid going back into a situation that kind of put me there in the first place. But I worked in rural South Carolina, underserved areas, and I actually ended up putting myself right back um, into what was, well, it started off very well, but then I was in a rural community where the hospital closed.
Mm.
Suddenly, we became the de facto emergency room. We became, the only place where people could go to get care, and the stress of that affected my heart, and I had to stop and leave
Oh, wow.
that
Oh,
position.
wow. So you became intentional with
Hmm.
any job you decided to
Well,
do, whatever you just
what
decided.
that did, it removed me from that job and made me realize I had to create my own entity so
Oh,
that I could protect
wow.
my health. And that's
Wow.
what I've done since.
Oh, okay. Okay. So, okay. I wanted to say, what advice do you give to other physicians? I realize we're not here for
Well,
that.
the thing is, for physicians, often what we'll do, and this is what the mistake I made,
Hmm.
I did something when I had to. Instead of prevention, I was forced into making changes.
Okay.
And unfortunately, many of us do that. We'll push ourselves to the point where we're not given a choice.
Giving a
Our
choice.
health
Wow.
fails to the point where we have no choice but to pay attention.
Mm.
And so one of the things that I focus on is biopsychosocial approach. And so looking at every aspect of someone's life and then trying to mitigate some of the problems that are coming down the pike. And that's essentially
What you did.
what I did.
Mm. Mm. Okay. So now, So what we're going to be discussing today is that how your health,
Mm-hmm.
also your weight, affected your hair.
Yeah.
Okay. So would you say you had hair loss or hair shedding? Like you lost a lot of your hair during the process of regaining your health?
Yes.
Or what did it become worse while you were dealing with congestive heart failure with diabetes?
Yes.
Which way did it go?
Well, it's really hard because I had just had given birth. So
Okay.
as many women experience, you lose, your hair sheds a lot
Mm-hmm.
after childbirth because of the hormonal
Yeah.
shifts. So that happened. Then I was put on medication which affects hair loss. So I was put on diuretics. I was put on other medications that were, for my heart. And many of us know that heart-centered medications often cause hair loss. Um, then the diet changes. I had to make sure that I was getting enough nutrients in trying to, address my obesity. Um, I also had to make sure I was getting enough nutrients to maintain all the other bodily functions that,
Mm.
required, including hair
Okay.
management.
Okay.
So as a result, I did lose a significant amount of hair, but at that time I didn't care. My focus was so much on my health
Your
and just staying
health.
alive. At one point, actually, I've never been someone who cared much about my hair anyway. Um, I I grew up in East Africa, actually, where often girls' hairs are shaved. They keep many
Mm.
times keep
Okay.
their hair very short and very, natural and short.
Yeah.
And so from a family of my mother, and I have five sisters, so six women, my mother, and all of us wore our hair natural. So that was one part of it. The other was that almost everyone in my family wore their hair short. I was actually the only person who kept my hair long.
Mm.
And so when my hair started falling out, my thought was, well, worst case scenario, I just shave my head. That's it.
So did you, or you just let your hair just grow?
I just let my hair go where it went.
Got it.
I didn't think much about it.
Okay.
Excuse me. And it wasn't until actually that I hit menopause.
That was what I wanted to
That's
ask
when
you
it
right now.
started to bother me. When I started losing hair because of menopause. Now the other thing is the women in my family lose their hair. We have like female pattern baldness. And so our hairline starts to
Mm-hmm.
recede. And that has happened to most women in my family. And when it started happening to me, I just did something. That was the first time I actually did something
Mm.
about it. I started paying attention to my vitamins. I started using topical agents, and continue to,
Okay.
because that's the only thing that keeps it at bay.
Okay. So just to go through what you just said,
Yeah.
when you were dealing with your health issues, your focus was mainly your
Yeah.
health, not the
Yes.
hair. You
Yeah.
didn't care about the hair. Now, when you hit menopause, that was when it went off. Ding, ding, ding.
Yeah.
Something is going on. I need to fix that. Okay, so tell us now. So we're going to go through the process, what you did.
Okay.
So who did you see? Did you see your regular doctor?
Hmm.
Because I know you're already a physician. Most
Hmm.
physicians try to treat
Yeah.
themselves. So did you go see your regular doctor first, or did you go see a dermatologist, or you
I
just
just
decided to just split?
it on my own.
Okay.
I started with minoxidil, topical
Okay.
minoxidil, and I said to him, if it hadn't
Okay.
worked, I would
Okay.
have gone to see someone else. I still may, just because I don't know what I don't know,
Okay.
so I always prefer to get the latest and to understand the best of what there is
Okay.
to offer. Um, if it weren't for the fact that I can still have congestive heart failure, I would even, there are other options, like even procedures that I might consider, but I tend to avoid procedures
Mm-hmm.
just because, um,
Outcome.
I just like don't do anything that's going to cause me any complications. So,
But it
um,
depends on what you're going to
yeah.
do. You
Well,
know, you
I
can.
don't, like I said, I don't know what I don't know. So
That's
if
right.
now that it's working, what I'm doing works, I don't feel the need to do
To
anything
do
else.
more.
However, I do make a lot of recommendations to my patients who are going through the same
Mm-hmm.
thing to talk to
Mm-hmm.
somebody who is more knowledgeable, more of an expert.
Okay.
Um, and that usually in my community, that's usually dermatologists. Um, but there are a few uh, plastic surgeons that do hair transplants, but I've never actually used them. I always prefer to go with dermatologists who start with a non-procedural process first,
Yeah.
and then use procedures as a last
Last
resort.
resort. Okay. So just minoxidil topical. How long
Hmm.
did you use that for?
I still use it. I've been using it for years, and
For
it
years.
and I just made for me mainly just watching for the side effects of any type of absorption
Hmm.
to see if it affects my blood pressure, affects anything else, and it hasn't. So I just continued using it.
Awesome.
To be honest, minoxidil is not necessarily a bad thing for me anyway.
Hmm.
Um, for given my cardiac history, so I just have to watch my blood pressure,
Okay,
and
that's good. You
and
don't have
since
any
it
side
doesn't
effects
seem to
from
be
it.
none, it doesn't seem to be absorbed at all for me. So I haven't had an issue.
Are you taking any supplements?
I take multivitamin. I have in the past taken biotin daily, but now I take a multivitamin
Okay.
with biotin in it, so I don't do that anymore.
Okay.
Specifically. Um, I do some other natural things. My daughter is very much she's in public health, and so she's always looking for ways of doing things that are more natural, and so she has actually makes me my own hair grease with what does it have? Uh, rosemary, castor oil, and a couple of other things. But I, since using that also, I've noticed a difference
Okay.
in in the lack of breakage. Like my hair doesn't get as dry, and so it doesn't break, and so I don't have as much of an issue with that as well.
Okay.
Um, and so, and I just like the idea that she, does this for me, and I can, it's just she's an adult now out of the house, so it's nice to. It
It's
smells good, it feels
smells.
good, so
I mean,
I yeah.
if it's not bothering you, that's okay then.
No, no.
Okay, so let's know. If it's not too much to ask, how much weight did you lose?
How much weight? So far I've lost. Well, now I'm at maintenance. I fluctuate. Well, I'm not sure
Okay.
exactly. I know I've lost 107 pounds from the
Can
last time I
I
weighed
scream
myself.
after? Can I scream? Can I scream because of what you just said now? Woo! 100 and what?
I lost. I know I lost at least 107. So the
Wow.
last time I weighed myself, I was 220.
Mm,
But I know I gained from
220,
there, but I never weighed myself after that.
220.
And
Wow.
then I was pregnant, and
Wow.
then and so the next time I weighed myself was after I was diuresed from my congestive heart
Mm-hmm.
failure. Basically all the water was pulled off, and I was from there I was just under 200, and now I hover somewhere around 111, 113. Now I'm 5 feet tall,
Okay.
so that's actually not
Ideal body
that's a
weight for you.
normal weight for my
Awesome.
my height.
Awesome. But that's impressive
Yeah.
though. And you've kept it up.
Yes.
So how did you keep it? Was it just through dieting, exercising?
Well, I couldn't
What is the main?
exercise because of my heart. So it was simply,
Oh,
initially, it
okay.
was just simply to get my diabetes under control, which
Okay.
is actually what sort of led me to what I do now, this whole metabolic weight management.
Mm-hmm.
Um, it wasn't that I lost weight and it controlled my diabetes.
Mm-hmm.
It was I controlled my diabetes and my weight came down.
Okay.
And that was a really important distinction, because so often we're just told is calories in, calories out. And it was very clear that my calories out was very low because I couldn't move. I couldn't do anything. I was,
Okay.
I was short of breath. I couldn't exercise. So it was simply it wasn't that it was my calories, it was the type of food I was eating. As long as I kept my diet fiber and protein forward, my
Mm-hmm.
weight came down.
Weight gain.
So
Good.
then, and that worked for the first 60 pounds.
Okay.
Uh, but it was very, very difficult. Like I had to really focus. I mean, literally, I smell bread and my body would start getting primed to make fat. My insulin levels would shoot up. And so no matter what I ate after that point, my body was ready to make fat out of it. And so
Mm,
it was a constant struggle. Then um, GLP-1 medications
okay.
became more widely used. It became harder and harder for me to maintain my blood sugar. It became harder for me to keep my diabetes at bay just with
Really.
diet. And so, but that started also affecting my heart. And so the decision was made to put me on a medication. There are
Mm-hmm.
some that, there are medications that were that this newer medication. Now, mind you, this was 25 years
Okay.
ago. Newer medications that have come out that are
Mm-hmm.
really good at keeping diabetes under control. It's not insulin; it is injectable.
Okay.
And so, for me, it was Victoza initially,
Okay.
and immediately my weight started coming down again.
Okay.
Immediately, my heart started improving again.
Okay.
And then when Ozempic came out, I switched because it was a better
Okay.
option. My weight dropped even
Okay.
further. And then when Manjaro came out, I switched to that and it dropped even
Oh
further.
wow.
Which is why I've become such an advocate for GLP-1 medications for weight management, because it really does hit the metabolic cause of weight
So
gain.
Manjaro. So from
All of
Ozempic, you
them,
switch to Manjaro.
all of them are good. And we've had these medications. I've been prescribing them for 15 years. I started prescribing them for weight management after I noticed my weight was being
Control.
controlled by them. And so and then later Saxenda came out, so it became obvious that that was
Okay.
we knew that
Okay.
we've known for a long time that weight gain, fat production in our bodies is a metabolic process, and so metabolic correctors work to reverse it.
Okay. So to ask you this question, follow-up question, what is your recommended amount of weight you're supposed to lose in a week or month?
Mhm.
Well, I'm asking
Mhm.
because, aggressive weight loss can cause, hair shedding.
Exactly.
So what is the recommended amount of weight loss?
Mhm. What I find actually is not so much just the amount, it's how.
It's how.
So even
Okay. So tell us how.
someone loses anywhere, so I always recommend half a pound to a pound a week, at
Okay.
most 2 pounds a week on average. That's the most. I slow down weight loss if it starts going more than that. Because usually when someone's losing weight faster than that, there's a nutritional component. They're malnourished. Usually there's some maladaptive diet
Uh,
issue going on, and it's that maladaptive diet issue that causes most of the weight loss. I mean,
So
sorry,
when
hair
people
loss.
so when people come in and tell me, "Hey doc, I was just started on one of the GLP-1
Mhm.
medications and I've lost 30 pounds this month." So you think there's a problem with that?
Yeah. That's
Okay.
too fast. Because then the other problem with that, apart from the fact that you have hair
Mm-hmm.
loss from poor
Mm-hmm.
nutrition as well as the medication, the other is you put yourself at risk for gallstones.
Mm,
And when you have gallstones, that puts you at risk for pancreatitis
mm.
and liver failure. And when
That's
that
right.
happens, it's just a vicious cycle. So it doesn't make
Can you
sense.
can you say that again for some of my audience at the back? There are some people at the back. I need
So
them to understand.
when you lose weight too quickly, it puts you at risk for gallstones.
Mm-hmm.
And when you have gallstones, it puts you at risk for pancreatitis. Now, pancreatitis is one of the contraindications for the medication. So if you get pancreatitis, many physicians will no longer prescribe it to you,
Prescribe
even
that.
if the cause was some other reason. But
Mm,
not only does it cause pancreatitis, it can cause backup into your liver and cause liver failure.
mm.
And so and you lose your pancreas, you lose your liver.
This-
It's serious. I mean, um, it's very difficult to live without either one of them.
So if they're having this aggressive weight
Mhm.
loss, so your recommendation is to reduce the dose.
Is it reduce the dose and reduce the process? Find out what part of the process is maladaptive and then adjust it. So
Oh,
either the person is not eating enough, so you need to reduce the dose so their appetite increases so that they
mhm,
can start eating more, so their
mhm.
metabolism is preserved. But the other thing is just for overall life in general. When you
Okay.
lose too much fat, it throws off your body function.
Mm-hmm.
Our body still needs fat to produce hormones.
Mm-hmm.
So if we lose too much fat, we lose our hormonal balance.
Okay.
And when we lose our hormonal balance, we definitely lose our
What about
hair.
in cases where people say, "Oh, doc, I'll just supplement with a lot of protein, high protein diet, even if I'm
Hmm.
losing a lot of weight. I'm gonna, increase my protein intake." What do you say about that?
The protein intake is a good start,
Mm-hmm.
but it's not enough if the weight loss is still rapid.
Rapid.
Yeah, it has 1 to 2, like I said, the most 2 pounds a week on average is what it should happen. And the problem we run into is that we're battling also years and years of diet culture and diet messaging.
Okay.
And so it's always been considered um, successful weight loss when it's rapid
Mm-hmm.
or when it's a lot. And
And that's a lie.
so, yeah,
Mm-hmm.
when in fact that's not really healthy. It's not psychologically healthy, it's not physiologically healthy, it's not socially healthy. There's a lot of adjustments that goes into losing weight. And as someone who's lost over 100 pounds, I can tell you people interact with you very differently when you're overweight and when you're not.
Mm-hmm.
It also changes the way you view the world, how the world views you.
Okay.
And so it really there's a lot of adjustments. And when the change is too rapid, those adjustments are just so much more difficult. Slow adjustments always better for
Okay.
any situation.
For any
And
situation.
so
Okay.
it's hard to adjust when the changes are just so rapid, and it's hard for the brain, it's hard for our body to
Mm-hmm.
adjust when those changes are rapid, because our body gets used to being one way and then all of a sudden we shift it to something else and it doesn't know what to do.
Mm.
And usually when our body doesn't know what to do, it shuts down.
Shuts down. Correct. Accurate. Okay, so let's talk about the clients you help.
Hmm.
Um, so now, have you had clients coming in with hair loss just as their only symptom?
Hmm.
Okay. And what is usually their presenting like what usually presenting
Hmm.
symptom or what usually do they tell you
Well,
about their hair?
it depends on the pattern. So I always get a history. Depends on
Okay.
the pattern. It depends on, when did it start? How did it start? Where are you having the weight loss? Is it on the crown of your head? Is it front of your, head? Is it, what's your family history of hair loss? Do the women in your family lose their hair as they get older? How old are you? When did it, there's so many factors.
Mhm,
You know, do you have dry skin? Is your weight changing at the same time? Could this be thyroid related?
mhm,
There's just so many factors.
mhm.
um and so I usually try to do a bit of a workup, because and often people don't even tell me. I ask,
Yeah. Okay. Okay. So usually
because
what workup do you usually start with if
usually I
hair loss
start
is just
with,
their only symptom?
well, I it's rarely the only symptom,
Okay. Okay.
because
Thank you.
people come to me for weight gain usually. So if
Okay.
they're having hair loss also, weight gain plus hair loss often means thyroid, so I check for that.
Okay. Okay.
And so and depending on what I find, determines what I do next. Just like with any workup in medicine, you kind of, you go by
That's like
step,
step by step.
and then you make decisions based on the result of each step. And
Okay.
so I rarely, usually what happens when I work with someone and I help them with their nutritional balance, everything becomes more balanced, including their hair growth.
Hmm. Got it.
So,
Okay. So usually what test do you usually recommend or usually you order for your clients when they complain with hair loss in addition to something else? What do
hmm
you usually
well, the most common, of course, is thyroid panel.
tell? Mm-hmm.
Then vitamin D, because that also gives us a nutritional background. I don't do a whole bunch of other tests, because they don't change my plan at
Thank
all.
you. Thank you. A lot of people ask me, what is your first, the lab test you order? I'm like, usually you need to talk to the client, talk to the
Hmm.
patient.
It's
From your
history.
history, from your physical exam, I usually don't order blood tests.
Yeah.
I don't do all that. Like, unless I can order TSH
Hmm.
or, vitamin D if I need to. But usually it depends. Every case is different. Like, you don't always have to order blood tests.
Exactly. And that
Okay.
blood
Okay.
test don't tell what I was taught in
Mhm.
medicine. Don't ask the question unless you're going to do something with
Do
the answer.
something about. Mm-hmm.
So I don't ask questions if it's not going to change what I'm going to do.
Mm,
If I'm going to still do the exact same, prescribe the same thing, check for the same thing, give the same advice, there's no point in me doing a whole bunch of tests
mhm.
for the sake of doing the test.
Awesome.
Um,
Yes.
and I was also trained to say that, you can diagnose anything. 95% of diagnoses you can diagnose with a good physical exam and a good history. You
Thank
don't
you.
need tests.
You
Tests
know,
are only to confirm
to confirm what you're.
what
Thank you.
you've already decided is there, and you've already diagnosed. And that's, but we've become so test reliant, and people have forgotten or don't really understand what the purpose of tests are. Honestly, I think it's lazy medicine. The more tests that get done, the lazier your physician is.
Okay, let me tell you something. Let me throw a trick question to you. I always throw this trick question. So when your client or patient come in and say, "Hey doc, I saw this
Mhm.
online there, I'm losing my hair. I'm losing chunks of hair. And this person said I need to order vitamin D, TSH, hormonal panel, this and this. What do you say to that person?
Are they a physician? They go to medical school.
Is that your first answer?
You know, I I always ask people when your car won't start, who do you ask?
That's right.
If you're suddenly driving and your car just stops running, do you go to the internet and ask the internet what to do about your car, or do you take it to a mechanic?
Take it to
You
a
take
mechanic.
it to an expert in whatever it is the problem. And
Okay.
unfortunately, yes, everybody has a body, but not everybody is an expert in what bodies do. So it's a similar, and also the other thing I tell people, listening to someone on the internet tell you what to do is no different than someone who flies in a plane telling you how to fly it.
But I mean, but they say they have all these titles to their name. So you think they
But
shouldn't
titles
listen to
for
them?
what though? I mean, even within medicine, I know what my limitations are when it comes to what I can and cannot treat. Not everyone who has a medical degree. Yes, now, true, if we have a medical degree, we are used to learning hard things.
Yeah.
And we can really learn anything. And there's anything in a book, you can learn
Okay.
it as long as the information is out there.
Okay.
Now, learning something and learning how to utilize something, how to use something is very different. And it takes years of
Yeah.
training to get to that point.
So the
If
answer is
that's
a
the
no.
case, why would we bother? If you could just go to the internet, pick up a book, or read whatever you need to read and just know everything, why do we bother going to school?
So the answer is a no. You wouldn't do it.
No.
Okay.
I just, but then I'm very mindful and very respectful of people
Okay.
who do seek out information.
Information.
You can't,
Correct.
because, for someone to have something going on and going to look for an answer
Mm-hmm.
it's better than them ignoring what's going on
That's right.
and not even bothering to get checked or bothering to find out if this is normal or not normal and what they should do about it. So
Okay.
I'm always very mindful of people and very grateful when a patient takes initiative in seeking out information. However, when they encounter superior knowledge,
Mm-hmm.
that needs to be acknowledged
Knowledge.
also.
Okay.
You know, and if
Yeah.
they don't acknowledge my superior knowledge, then I'm just not the right doctor for them. And
Okay.
and if I haven't been able to convince somebody that, you know, based on my recommendations, which is it's always a partnership with patients anyway.
Okay.
If I can convince someone, then that's my failure, not theirs.
Got it. Okay. That makes sense. So what is usually your top recommendation for clients coming in with hair loss and weight changes?
Hmm.
I don't just want to say weight loss or weight gain. With
Yeah.
weight changes, what's usually your top recommendation?
My first recommendation is pay attention to
What
what you're eating,
are you
your
eating? Okay.
consumption. Our hair is, again, hair loss is a symptom
A
of
symptom.
something
Mm-hmm.
else.
Mm-hmm.
Our hair is doesn't just grow on our head without a process
Okay.
involved. And so you have to go back and figure out, you understand what makes our hair grow. What is our hair? Where does it grow? Where does all of the process come from? And you work
Mm-hmm.
backwards. Start from the beginning. And so from the beginning, it's your genes, it's your genetics, your age, and your age plus genetics, and your diet and your other habits. And so you have to go back to that first and then see how that influences the next step, then the next step, then the next step. And then determine when it gets to the point where it's out of my wheelhouse and someone else needs to step
Mm-hmm.
in, or which, given what I do, it's almost inevitably thyroid or
Or
nutrition. And
nutrition.
so when I correct for those things, it corrects for the hair
Correct.
loss.
Okay.
Um, and obviously, I can't do anything about someone's genetics.
Okay. I mean, that's right.
Yeah.
You can't do anything about genetics. That's right. Okay. So that was really insightful. So about any final words of advice to people listening today,
Hmm.
in terms of their health, not just, weight loss, weight gain,
Hmm.
hair loss, and all that. Any final
The final
advice about
advice
being intentional? about
Okay.
your health.
Be intentional, but do not let anyone make you feel that
Mm,
paying attention to your weight, paying attention to your hair is
mm,
vanity,
mm.
because they are symptoms of something else that is health related, and you have every right to get an answer. And you have
Okay.
every right to pay attention to it. And you have every right to care about your appearance.
Mm,
It's not vanity to care about how you look. That's part of your psychology. How
mm,
you view yourself, how you love yourself, what you see, and how you process that is still part of our psychology, and our psychology is us. And
okay.
so it's okay to care about your appearance,
That's right.
um, regardless of the reason.
And it's okay
Um,
to also bring it up to your regular doctor. That, hey, I think I'm
yes.
gaining weight. Something is
Mhm.
wrong.
Yeah.
Okay.
But I can tell you, if your doctor says exercise more, eat less, yes, you should be exercising. Yes, you should be building muscle. Yes, you should be maximizing your nutrition. But there still should be other questions asked,
Mm,
and those questions should be answered. Is there an underlying metabolic issue? Do you have insulin resistance? Do you have prediabetes?
mm,
Do you have diabetes?
mm,
Did this happen right after pregnancy? Pregnancy is a metabolic
mm,
disruptor. Are you going into menopause?
mm.
Menopause is a metabolic disruptor. Um, so there's lots of different questions that can be asked. Now, one of the things I do not do, and this is something that we get asked for a lot, is for hormonal testing. Menopause is a history.
Thank you.
Menopause is diagnosed based on history,
Mm,
not based on labs.
mm,
Our hormones fluctuate. And in fact, one of the most common hormonal changes that occur in women is a drop in testosterone. And that's always going to be low in comparison to men because of the way the testing is done. So, you just base it on other things, not lab tests. So, so when people come to me and say that they're having these changes, I always ask why, and the why then directs me as to what has to happen
mm.
next.
Awesome. That was good. Thank you for saying that because it's not all about lab tests. I
No.
try to stay away from ordering lab tests and all that.
Yeah.
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 Thank you so much. Now, how can our audience connect with you? I don't want to forget that.
Okay. My audience can connect with me through my website,
Okay.
drtumor.com. So there is a link in the contact where you can make an appointment,
Okay.
a consultation appointment with me.
Okay.
There's also a way if you want me to speak at an
Yeah.
event or, talk on different topics, which I do often,
Hmm.
not just about weight.
Okay.
I've been in medicine 25 years. I talk about a lot.
Uh-huh.
And also, so there's that in my website. Now, my most active um, social media is YouTube and Facebook,
Okay.
and so both of them are Dr. Tumor.
Okay.
Facebook.com Dr. Tumor or YouTube.com Dr. Tumor. And I do a live show every Tuesday
Okay.
evening. I'll do actually today, 6 p.m. On Facebook, YouTube, LinkedIn,
Mm-hmm.
and talking about health, wellness, and weight care processes.
Okay.
And but those are live streamed,
Okay.
so you can find them in YouTube. That's another way to contact me.
Okay. Is there any upcoming events?
Any upcoming events?
Uh-huh.
Well, I did launch my national
Oh,
group.
awesome. I
Um,
see. It's
yeah.
awesome. You see?
So I
Nice.
have
Okay.
Your Light Wellness and Weight Care was created to fill a gap in people losing access to their metabolic medications. And so what I did is I found that people were losing, access because of cost or because of insurance coverage. And so I vetted a compounded pharmacy who then asked to partner with me to create a access for
Okay.
patients. And so I gathered a group of doctors. I just kind of put the word out, doctors to join, and we have most states covered. I think all but three
Okay.
states covered, including DC and Hawaii.
Okay.
So so that's what we have now. That can be. I just realized it's probably not on my website. I need to
Yeah.
add
So
the link to my
explain
website.
that a little bit. So you said what is it? Explain that a little bit.
So
Mm,
any patient who feels that they need a doctor in their state. So the way medicine works, you have to be licensed in the state to treat patients in that state.
yes.
And so I was limited because I only had a few licenses, but
Mm-hmm.
there were patients coming to me from all over the
All over.
country.
Okay.
And so what I did was gather doctors who had licenses in all these different
Okay.
states so that I had a place to send patients
Okay.
and so right now it's a formal group,
Okay.
and we cover all but 3 states. We're still working on gathering those states as well.
So is it like
And so
telehealth or physical
it
in
is
clinic?
telehealth, it's all
Okay.
virtual.
Okay.
Some of the doctors have offices as well, and but that's something that you discover once you're connected to the doctor. They can tell
I
you
can
if
tell
they're
you.
where, if they have some place, a
Yeah.
location. um, and so it's really was just a way to make sure that people didn't lose the benefits,
Mhm.
all the benefits. And weight is just, again, a symptom.
Yeah.
It is still treating
Mm-hmm.
something that causes weight loss.
Mm-hmm.
And so, but there's other processes that are caused by the same thing:
Mm-hmm.
inflammation, small vessel disease,
Mm-hmm.
dementia, heart problems,
Yeah.
eye blindness, kidney disease. And so all of those things were being treated also.
Mm-hmm.
Fatty liver, it's
Mm-hmm.
another. Depression, anxiety.
Okay.
um, and so when people lost access to their medicine, it wasn't just about weight loss, it was about everything
Every
that,
other disease.
and that's
Okay.
what made it so
Okay.
important to find an alternative.
Now, is this insurance based or?
It's not for most of it, because
Mhm.
well, there are savings accounts that cover the medications if
Okay.
that's the case.
Okay. Okay.
There are many of the physicians who do take insurance. Some are mostly cash based,
Okay.
mainly because insurance doesn't cover a lot of what we do,
Okay.
unfortunately. That may change now that we're talking about prevention.
Mm-hmm.
So maybe
That's
that will.
right. That's right. Thank you so much for all you do.
Thank you.
Thank you for the wealth of knowledge you've given to us. And I think we're going to have you back.
Oh, thank
And
you.
thank you so much.
Hmm.
And
And thank you, because you've actually reminded me that, in being more intentional, it's not enough to just think you know what to do. It's
mhm.
really important to get an expert's
Yes,
advice on what should
advice.
be
Yeah,
happening. And
yes.
so I will be contacting you.
I know, and that's why I'm a hair loss coach. And usually, when I say I'm a hair transplant physician, people tend to shy and say, "No, you're just going to sell hair transplants." So I had
Hmm.
to say I'm a hair loss coach, hair
Yeah.
restorative physician, so you understand there are different options. That
Hmm.
actually what drove me into this because I was only sold hair transplant.
Yeah.
So I'm like, no, apart from the hair transplant, what else can I do to my hair?
Yeah.
Because I was losing so much hair. So that's I'm a hair loss coach. So if you want to,
Yes,
contact me. I'm
definitely.
here for you. Questions, whatever it is, I'm here. But thank you so much. Thank you so
You.
so so much. Okay.
Thank
So
you.
guys, you've heard everything she said. Please contact her. I think it's easy to find her, Dr. Tumor, on YouTube, Facebook, wherever you just type it in, Dr. Tumor, Toomer. You can't miss it.
Yeah.
Toomer, and you
Yeah.
will find her. Thank you so much.
Thank
Bye
you.
bye.
Bye.